Hi, Denicia. Welcome.
Hey, Andrea.
I'm so pumped for this conversation.
Ditto, ditto. I'm like, let's ride. Let's ride.
All right, let's do this. Okay, so I'd love for us to maybe just start with a little bit about your journey to becoming a doctor of Oriental medicine
Yes.
and
So,
your practice and like why are you choosing to serve people this way?
mm, okay. So I will say that I had to come into agreement with what I was assigned and to actually agree to do it because
Mhm.
originally, when I was younger, I actually wanted to be a marine biologist. And
Hmm.
I know, um, since then, like in my whole spiritual journey of learning about different things and whatnot, what then ended up happening was outside of that is I wanted to go into medicine. And we were in and out of the hospital a lot growing up. And I just remember being very curious and I was always asking questions about certain things, wanting to know how things were working and all of that jazz, right? What happened was one day I had that itch. Yeah, I'm enjoying this, but I'm missing something doesn't feel quite right. Well, then I had a little another curveball when I went to go and meet up with a sorority sister. And she's like,
Mhm.
well, what if you could treat patients a different way? And I was like, what do you mean a different way? Like there's another way. And so she's the one who actually introduced me to acupuncture oriental medicine. And then specifically contemporary oriental medicine because that's the lineage that I trained in.
Okay.
And um I why I said yes to doing that cuz that's a choice, right? Like which way do I really want to go? Why
Mhm.
I said yes was because of the way that the medicine views the people. You weren't seen
Mm.
as a part. You were seen as a whole person. And then practicing the medicine became a journey of how do we facilitate this with someone and them recognizing their wholeness and them realizing that what's showing up in the physical form is an expression of how they're living out in their life. And
Yes.
then as I practiced, it deepened, like that deepened for me. And then my perspective on it was I see this actually as a connection to the expression of who they are authentically.
Yeah.
And if that is not showing up or how it's showing up and whether or not it's congruent is where we would start to get these signals. I call them signals now to try to delineate between very hyperclinical um
Yeah.
coming from the body, like coming from the whole body.
Mhm.
And then I'm like, it's all relational. It's a relationship with the self and it's a relationship with others.
Mhm.
And so to see like all of it, that's just like a timeline kind of thing, but I needed it. I
Yeah.
feel like I wouldn't have appreciated it and appreciate where I'm at now if it didn't go through that pathway.
I love that. Okay, so for people listening in, can you explain? I know what you mean when you say looking at the person as a part, because that's the same in mental health, except for family therapists. They're taught to look at the whole system,
Hmm.
the whole family, the whole person, the environment, everything. But all other practitioners are very much taught to look at symptoms or a part or a piece,
Mm.
which for me makes zero sense. But I think that that's something that not a lot of people understand of
Hmm.
how a typical practitioner is taught to look at their patient. Can you just
Right.
speak to that just a little bit?
Yeah. And I will try my best to delineate generalities versus Denisia's style, by the way.
Totally, totally.
So okay, so yes, the medicine, like Eastern medicine, goes in with, I mean, you're starting out foundationally, everything's connected.
Yeah.
And then you're starting out with, all right, even though everything is connected and there's a macrocosm, you can actually like hone in and
Hmm.
look at a microcosm. So something, some area specifically, and then be able to gather information from that as it can represent the whole body. That's one
Right.
way. Then the other way is you can hone in and say, all right, this system, like this organ system has a role to actually play to the functioning of the whole body, the whole person.
Right.
And so then you start to see, well, if that one's starting to express itself in the form of these signals, what is it telling us?
Mm-hmm.
And did like, okay, I'm gonna kind of see if this helps too. I kind of see everything as a playground. All right. So like my whole space is called the perfect playground as well. I see, so it's like there's a space playground, but then there's you, you're the playground. Okay. So when
Mm-hmm.
you think about you're on the playground and it's like there might be some instance of some type of fight that starts, right? And but you kind of go in and you're like, dang, who started it? And then they and then they go back and forth, right? It wasn't me.
Mm-hmm.
Well, I only did it because you did such and such, right? Like,
Yeah.
so it's kind of like that when you think about the five phases and you think about their roles, like their role to the whole. So and I want to say this because with so much access to being able to look at reels and memes and all of this jazz, what you are seeing is somebody saying like, "Oh, well, I was told that I had a liver cheese stagnation," and then they'll just go and research liver cheese stagnation. But then, like, really, it's so superficial that like you can get information from that, yes, and you'd want to actually expand on it and
Right.
understand that is one piece to the whole, right?
Yes.
And to the functioning. And then it's once again, it goes back to the playground. Who started it? And then like, and why? Um,
Mm-hmm.
and so when you look at that, like that's the medicine is like you're looking at seeing the state of these phases and these organ systems, how are they interconnected and related with one another? That because of that, it's trying to self-correct, right? It's in a position for your body to actually still go and to still function, to still move. And then it's calling on resources from one another. And so it's kind of like in that process that can cause something else, right?
Yeah.
And so but at the same token though, you're looking at all of it as they are related. Um, and now I'll say this because in some ways, where some people would say like, oh, they just want to go Eastern medicine, natural, holistic, whatever, and not Western medicine. I mean, I invite you to really take a look at how they're practiced because the one of the reasons people say like they are leery of the Western medicine part, they only want to treat the symptoms. I'm gonna let y'all know a little secret that still happens even in Eastern medicine. So
Interesting.
yeah. So because you see it not just within the practitioners, but you see it online as well. It's like, what herbs can I do for blood deficiency? What foods for
Yeah.
blood? That's mitigating a symptom. It's the same thing.
Yeah, totally.
But when you can actually get into evaluating someone's life, past, coming up to present, and then their outlook on the future, then you can start to see how the systems, how the whole body is actually in relationship to that environment.
Yeah.
And so what you're seeing then is, like I said, it's an expression of. So those behaviors that someone might be exhibiting, they're doing it in response to their environment. So, what was in their external environment? What's going on in the internal environment? So, like, you don't get tied up into like what the behavior is, trying to label it good or bad, maladaptive or not. No, it just is. And so we can neutralize it and then we can now open ourselves up in curiosity as we engage with people and seeing, hmm, so where did this behavior? Why was this
Yeah.
behavior the answer, at least in this point, for you to feel like you can thrive and for you to keep going, right? And
Mhm.
then now put that against, well, what are you actually really desiring for yourself? And okay, that's cool. Well, does this behavior actually does that represent this one or does it not? And then if it doesn't, we got what? Look at this. We got choice. Like we got conscious choice now. And so while a lot of stuff might have been running the show in the background, it's like, but in some people, for some to realize that they actually have choice now in their life can mean a big thing to them. And it can be so new that it's even scary. And
Mm-hmm.
so then that's where I see that that's my role, is to be there to support them as they're making these choices, right? It's where it is that they have been so outwardly powered that by the time they get to that empowerment, it is new and it's different and it
Mm-hmm.
feels different. And they're like, I don't really know what to do. That whole shift from seeking for permission without even realizing it from others to now you don't need to can
Mm-hmm.
really get people in a position of like lost. Like, uh what do you mean by that, and then that feeling the weight of then on themselves versus blaming others, or where they may not been doing, knowing that they're doing it right. So like
Mm-hmm.
that's like Denisha styles right there, because not every acupuncturist, doctor of Oriental medicine, like not everyone is going to do that. Not everyone practices in that way. I am depth like that. I see it like that. You'll see it reflected in contemporary Oriental medicine. That's the lineage, with Dr. Shen and Dr. Hammer, from my school. So like that is like infused, it's ingrained, but then also it's just me, my period.
Yeah, it's your gift.
Um, yeah. And it's just that I was able to call it out. Like it was able to come out as I actually went to school and then started practicing
Mm-hmm.
it. And then now I just color it in my way, and then support, like where it's not this traditional clinic. That's why I added on the consultant part, like the holistic well-being
Yeah.
consultant, because I'm consulting really
Mm-hmm.
along the way. Now, are there herbs? Are there foods and supplements? Are there labs? All of that? Yes, they are. They really are. Do they facilitate? Yes, they do. But the thing is, what I'm looking for is for people to see where they might use they might declare their own prognosis of health based on what I say, based on what a lab report says, based
Mm-hmm.
on if a supplement is present or not. And so it's like that's the practice of placebo effect and nocebo effect. And
Mm-hmm.
where I'm like, if we introduce it, I want to see if you realize that your healing is not dependent or reliant on this. We're using this as a set of glasses where we're looking at it through this lens, the state of what's going on. But you still
Mm-hmm.
are in the driver's seat and can heal in whichever way it is that you're looking for.
Okay, so with what you just said, I'm very curious. Let's use me as an example. This isn't even mental, that's not true because mineral levels affect mental health, but I had a mineral hair
Mm,
analysis and I
love those.
had some significant deficiencies.
Hmm.
And now that I'm evening out my mineral levels, I obviously feel better, right?
Mm,
And so because I want to make sure I understand what you're saying, where would that come in? Are you saying that people can heal without addressing things like that? So if I didn't take minerals to equalize my minerals, I could heal my mineral levels differently, then is that what you're saying? I just want to make sure I understand.
yeah, no, I appreciate the question actually. And I do that testing as well. What I'm saying is, while we have that as an option,
Like as a tool or
mm,
whatever.
exactly, and you're going to use it, that's fine. Go ahead, do the
Yeah,
supplements.
right.
Here's what I start testing is I don't want you to continue on those for a
Right,
really long time.
right.
When you hear and you come across the people that will whip out the ones that they've had in there, like very proudly, I've been doing these for 15, 20 years, and this is what I'm
Yeah.
saying, right? Like that's their thing. And so that's what I'm looking at is I want you off of them. And now here's the thing too, and this is what I check for. If it starts slipping again, that tells me we didn't even address why
Like the
you're
core issue of why it's going back down.
so if your magnesium keeps going lower when you're not even supplementing with it, and let's just say your food, you're getting some through there, whatever it is that your body is deeming as a stressor is
Yeah.
using that as fuel to get you through it. Was that ever really addressed? Did we
Right.
explore that aspect of it? And I mean, and that goes for any of them, right? Like that goes for the calcium, the phosphorus, the potassium, any of them. Now,
Mhm.
where those show up and how you know from the test, but for those that may not be aware of this, but like those ratios that show up and how they would represent the thyroid or represent the adrenals and whatnot, right? It can be it can be like just enough information, like a surface where you're like, oh, thyroid. Like we really want to make sure that we're not doing anything to impede either thyroid hormone functioning
Right.
or the conversion to be able to be used, its receptivity, right? We're really looking at that. Now here's the thing. Great. And like I said, you're still going to need to use it. Like, I think that's the thing is that, like, when, and even in those camps, when they're talking about like balancing it out, it's like, or can we really work with people to get them to see that one, it's going to ebb and flow? That's the point. Ebb and flow, rhythmic, that
Hmm.
it's supposed to do what it's supposed to do. If you are literally in response to your environment, so once you understand that, then we can now explore why is it that this calcium is doing this
Yeah.
compared to this phosphorus, right? Why is it that this calcium compared to potassium is doing this? And then that's where if it's thyroid, and then now I can blend in the other stuff that I know, um, and including like in medical intuition, and it's like, oh, that's fascinating. And then I'm tying in Eastern medicine because I'm seeing other things pop up. It's not just the thyroid, which even when you go biomedically, you realize that the thyroid hormone does so many things in the body. So
Yeah.
even when you look at the minerals, it's so funny to me because it's like if you kind of look at the list, they're all repeating each other. And then,
Mhm.
it's like, well, the calcium also helps with the blood. It helps with heart regulation and stuff. And then you go and you look like in magnesium, you'll see similar things on that list, right?
Yes.
Because they all work together
Right.
and they all can do similar things. So that's where it is that we can add in and layer in. All right, well then what are the other signals that are coming up that through, here go my glasses, through the lens of Eastern medicine can now get me to see, Andrea, like, yeah, I see that this is showing up and we have this on this minerals test, but I want to know why. I want to know what's driving that use of this mineral,
Yeah.
but then and that's leaving this other one here. Or I want to know why, like, what are you eating that's potentially driving up another one,
Mhm.
right? And then, because now we're going into your life.
Mhm.
And so then it's like, yes, acutely take the supplements, do that. And yes, it's going to change the mental health, right? But then when people say mental health, that's where I want to ask them, what are you looking for?
Yeah.
And you know what I mean? Like, so and oftentimes it's like, well, I just want to be at ease. I don't want to feel anxious anymore or depressed anymore or sad anymore. And it's like, okay, that's cool. That's great. What else can we add to that? Well,
Yeah.
how does that show up? How does that look? Well, the anxiousness comes whenever I'm getting ready to go meet my family. That's what we really need to address.
Mm-hmm.
The anxiousness is a response to that.
Mm-hmm.
So if you're going in just like, oh, we're just going to reduce the anxiety and the feelings of the anxiousness. Actually, what you did with the supplements is you just gave it the fuel to be able to kind of keep the system and the nervous system kind of calm.
Yeah.
But you still are about to run through it like crazy because you still have to address what is it about that dynamic of going to meet your family.
Mm-hmm. Mm-hmm.
That's how we create sustainability.
Mm-hmm.
And then over time, you start testing by weaning off of them and seeing what happens, right? You're addressing if there's the change in the foods and whatnot. Like some people, as they address that, they actually realize that their cravings change as well, right?
Mm-hmm.
And it's like super great. That's exactly it. Like when you kind of add that stuff in, it mitigates, right?
Mm-hmm.
And so does that answer and kind of paint how it is that I was
No, it
enlightening?
does. It does. So this kind of leads me to what we were talking about before, like you take this whole body approach. And I know you have already touched on this, but I want to talk about it specifically in regards to mental health, if that's okay, because
Yeah.
really they're one, mental and physical are one and the same. And I think people struggle with that concept. Um, and also our physical can be screaming at us when we think we're really mentally solid, right? Like that's my story is I'm a really resilient person. However, my health took a massive decline because I used to be really good at like pushing through, white knuckling it, right? Like just handling things and my body was like, no, we're not doing that anymore. And so I think people don't always understand that though. Like people don't
Right.
understand how deeply connected our mental and emotional well-being is to our physical and vice versa.
Hmm.
And I would love for from how you practice and your perspective and all the lenses you work with, can you share a little bit more about that?
Yeah, I would say that one of the first things for many people is when we are looking at mental health and that's what's pushed in that it's like this paradox that I see because they really want to feel well. But isn't that interesting that they say they want to feel well, but they actually don't want to feel?
Yes, some people do not want to feel.
And so then
It's
therefore to
uncomfortable to feel.
yeah. And so it actually is a coping mechanism
Yeah. Hmm.
because it's another way that you can maintain yourself in your head.
Yeah.
And if you're in your head, then you're dissociating
Hmm.
from the rest of the body.
Hmm.
And so then now that's where we can explore where did this dissociation stem from?
Hmm.
And for many people, it could have been some type of assault, unwanted assault onto the body. And it
Hmm.
comes in many forms.
Yeah.
It could be simply you getting vaccinated when you were 3 days old,
Hmm.
right? It can be, yes, sexual assault also, but it's just like to go in and try to be as neutral as possible. None of these are hierarchical. Nothing is worse than another. It's just simply is what it is on a personal level. At some point, you might have felt like you did not have choice over your own body.
Hmm.
And so you kind of like that's when it is that we'll start the dissociation. It's like, well, I can't even like do what I want with my own body. Like somebody else is going to make the choice and somebody else is going to do
Yeah.
it. You know what I mean? And so then when we do that disconnect, we're doing it in a way of self-preservation.
Yeah.
And then at some point though, it will want to reconnect because that wholeness is our natural state.
Yeah.
And so those when we're feeling those things like in the body, in the physical like body, and I'm doing this like for those I mean I mean maybe audio, like only the audio, it's like my hands are at my neck and then going down. And that's because
Yeah.
the mental part many just stay like they're just only in the head, right? And we have some points that are even along the neck and that are called ghost points. And I thought that was really fascinating because that's where we can bottleneck ourselves. If
Ooh,
those,
let's talk about that. What is that? Tell
so
us
it's,
about that.
yeah, like there's literally these points, like ghost points is in acupuncture,
Okay.
and that it was kind of like you can needle these points and then it would just all of a sudden open up a whole new way of seeing.
Mm.
And so when you're working with someone and you see that, the way that they're seeing themselves and seeing other people, there is a disconnect. I wonder if I needle these ghost points. It's kind of like think about a ghost as kind of like they're lingering and you don't really know what it is. And so, hmm. And I just thought it's just very interesting that they are on the other parts of the body, but there are a lot of them more around the neck.
It
And
makes sense to me though. Like think about our it's connected to our brain, it's connecting to our body, very
yeah,
much so powerful, the nervous system right here, right? The big like it makes sense to me why there would be more in this area.
precisely. And then what
Yes.
else is around there? Your
Yes.
throat,
Yeah. Mm-hmm.
that thyroid.
Mm-hmm.
And then you hear, well, most women are diagnosed with thyroid issues. What's a
It's
common thing?
crazy.
What's a common thing though amongst women?
Uh,
Whether or not they're going to express themselves in the way that they desire.
yeah.
Do they
Yeah.
feel comfortable to do so? Had they tried to do it before and it was not taken well or taken for granted, not listened to, and yet there was still some type of assault on there?
Yeah.
How is it that they are expressing themselves? Are they repressing it so much just to try to make it through? And then you're burning through those minerals that actually the thyroid relies on.
Yeah. I mean,
It's
I'm watching my
functioning.
daughter do it right now at her dad's house. She comes home and I'm like, "Oh,
Mm,
did you talk to him about?" And it's like, "No, I don't want to get in trouble or I don't want to upset my stepmom or he doesn't listen." So I'm watching her. She's very, she's my kid, so I've empowered her to speak her
hmm.
truth and share her feelings, and that's not so much over there. And it's a perfect example because in some ways it's like considered benign, right? Like like, oh, okay, you're getting shut down by somebody, but it's so profound. Like I'm watching her actively struggle. And this is like a perfect example. It's not always these huge catastrophic things that we think
Right.
as people,
Exactly.
like this, the way that we think of trauma. I mean, these things are little micro traumas that are happening to her regularly that are affecting her voice and her health and
Yes.
subconsciously and all of these things, right? I just wanted to give that as a little example.
And
But
I
like,
appreciate that because that's when, and I said it that way because I didn't want people to think that I was either minimizing or gaslighting any type of traumatic experience because I'm not. It's actually personalized. We're
yes,
looking at the body's response to an experience, right? And then that determines if that was like traumatic enough where it couldn't recalibrate itself to
yes,
that person. So this is where it is that you want to like even observe yourself. Are you judging and creating some hierarchy for yourself about
right.
your own experience? And that's how people would gaslight and bypass themselves. And then where are you doing it for onto other people,
Yeah.
right? And so then this was something I actually noticed this with myself years and years ago. And then I realized like I'm pretty sure it's not just me, but I'm picking up on this is that like where it is that we're doing that for other people, it's actually within ourselves. It might be something that we might want. And that's why we're calling it out. That's why we're so upset. And we might be jealous. We might be envious, but you don't want to call it that. You just want to be, you might just want to be mean and be petty. Right. And that's the way that our society has groomed it to make it a little bit more acceptable. But
Mhm.
then, like, even then in the case with your daughter, right? Like, if that was, if I was in your shoes and in your position, then it's like, yeah, it's really great prime opportunity for her to see that, yes, not everyone is either going to want to hear what it is that you have to say. Two, depending on what it is that you're wanting to say, is it that you're doing it from a state from your wholeness, or are you seeking acceptance or agreement? Is
Yeah.
that what you're actually seeking versus I just want them to listen to me? Because sometimes that little nuance really can make a difference for people, especially start to when they start to exhibit behaviors that they're seeking approval, they're seeking acceptance, they're seeking agreement. But right, but when they can really realize like just because someone does not may not be welcome to hearing it does not mean that for you it's not valid. And then how is it that you can express this though? How still can you express what it is that you're desiring to say, and so that at least it gets that part gets processed, it gets out there, right?
Yeah.
And then whatever it is, I mean, I don't know this scenario or situation or anything like that. So of course if it's like something that really with her dad she needs to whatever, but it's just a way that like what she's learning now can definitely be used in other areas of her life as she grows, right? And as
Absolutely.
she just interacts with other people and getting jobs and all of that, as like you're in, if she does Girl Scouts or something like that, like it's all a part of the teams and things. It's all that communication and relationship with one another. And so it's like this whole practice of how can I support her to not continue to repress it And can she still express what it is that she wants to say in a different way?
Hmm.
And you know what I mean? And then the allow kind of get her to see that there's other ways that she can still express. And like, even when you think about this bottlenecking, like, imagine too that the next area is this chest space. So as it comes from up here in your head and you're
Hmm.
processing and integrating, you're taking concept and abstract and it comes into form as it goes down, you move into the heart area. Most people only go to the heart. Like, and I'm thinking, do y'all know that right around that heart is huge sets of lungs?
Yeah.
Like huge. Like that's how much is there in this space.
Yeah.
So imagine that right next to all this joy and love of the heart is grief and sadness.
Hmm.
And that takes up even a bigger space because it's that, even that grief, even for her in that situation, she might be potentially grieving what she thought could have been something, some
Oh,
dynamic
definitely.
with her father.
Yeah, definitely.
So then how do we process that grief, that loss, while still she can still see and maintain her wholeness? And then knowing that what she is desiring is so valid and true for her.
Yeah.
That's the type of dynamics of what I mean when it's like it's navigating the life and then this journey versus it being some type of destination, some
Hmm.
expectation on the other, because they may or may not be ready to hear what it is you want to say. They may be at a point for themselves that they may never get to.
Yeah. Hmm.
Yet the charge can still be on you as far as, hmm, how do I navigate this? How do I actually still maintain my wholeness, still freely express myself? And a part of that is surrender and also observing your expectations.
Yeah. So when you meet with somebody and they come to you with either a mental health complaint that they want to resolve or a physical complaint that they want to resolve, is this, besides the testing and all of that, is this where you go with people?
Yeah,
And how do
it
people, most
comes out
people,
naturally.
well, good. I mean, I love it, but how do people, this is where I feel like people, it's really a struggle for people to understand that how they're living, how, the things they're choosing, patterns they're leaning into that maybe it wasn't their fault that it started, but they're perpetuating them, like all these things, right?
Yeah.
Relationships, environment, has such a profound effect on our physical and mental health. And so, how do people receive what you have to say? Are people pretty receptive, or is it kind of a struggle for some people?
I will say that they're pretty receptive by the time they get to me. So if I think about like
Yeah.
the circles, the concentric circles, right? If you're just kind of out in social media land or whatever in your life, and then you hear about me some way, there's more than likely you would have come across like I'm more active on threads right now, right? So like if I say something on threads. I'm not faking the funk. I'm not trying to like do it to build some algorithm or anything like that. That's just genuinely how I see things. So then if all of a sudden you're, she keeps popping up, I'm kind of digging what she's saying, then you kind of like, so it's like you kind of go through those circles and you kind of get to that, to the inner circle to me. So by the time someone would get to me and then say, I do want to do this master being consulting thing with you, whatever, VIP day. By that time, all that they know and agree to is we're going to probably be addressing some stuff that I don't even see, or or
Right.
even the things that I do see, and I know that we're probably going to go into it more. And
Yeah.
so it's like they know that part, which is just enough, which is great, and just enough for them to say like, yes, sign me up. And here's the thing too that I did want to point out is that um because I noticed this with other people as they were making choices of choosing who on their care team and whatnot, right? Is I'm not in the camp of trying to re-traumatize. Okay. I
Yeah.
don't need all of the details of things that happened. All right. And Here's why. And I actually have personal experience, and then plus this is clinical experience of even observing it as well. Um, so in contemporary Oriental medicine, there is a diagnosis of heart shock, which is something that you don't really see in traditional Chinese medicine. Um, and so with that, it's just saying whatever experience it was deemed as a shock to the heart and therefore affected circulation. We know circulation is head to toe everywhere, deeper depths all the way to the skin
Mhm.
surface, right? And that it created some turbulence. And then whether or not you actually recalibrated from that, and it's like, oh, okay, well, we definitely need to we need to get the blood flowing. We need to nourish the blood if it was already a little bit lower, underperforming, right? And the thing is, I'm looking for patterns.
Mhm.
So when I ask people to neutralize, I'm doing it. I'm in observation. I'm not here as your guide. I'm a guide. I'm not here to be the judge and saying, yeah, like that was great. That was bad. This was horrible. Da, 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 da. I'm not there for that. What I'm
Mhm.
there for is seeing how you're responding. I'm observing how you're responding and then seeing through the different lenses, the nuances to that. And then from that space, we can say, well, if this is showing up here, then they're like more spleen stomach. That is a concept of knowing, discerning yourself from other people.
Mhm.
Got it. That's all I need.
Mhm.
So for some people, it's a relief because
Mhm.
they don't want to have to keep it. Now it's like, now here's yet another person I got to talk to about this. Right. And
Mhm.
it's like, all right, cool. I'm not going to ask you for all the nitty gritty details. And here's what happens is it's really interesting is that, almost unsolicited, it's not almost, it is unsolicitedly, they'll bring it up. But it happens in such a casual way that
Yeah.
you can feel that there is no emotional charge.
Mhm.
And that's when we know then that aspect is good. It's healed, right?
Mhm.
That aspect of it, that relationship with whatever it was has changed. Those dynamics have transmuted and they have changed.
Mhm.
And I intentionally don't say releasing anything either, um, because energy is neither created nor destroyed, it is transmuted. And so my way that I look at things is you can't unlearn it. It already happened. You can't unlearn it, right?
Mhm.
What we can do, I mean, it would be kind of cool if like Dr. Strange wise, but like, it's just what we can do though is we can transmute our relationship with it.
Yeah.
And notice I said it, like meaning the concept, the pattern. I didn't say the people. So
Mhm.
that's where it is people can get tied up is they're looking at the people only when really the people are the actors of the concept.
Yeah.
That's why people can see that same pattern popping up and it comes in different packages and different forms because it's the pattern in and of itself. And so if I can facilitate like with you working with you thought wise, mind wise, emotion wise, right? I'm using the interpretation of how the other physical signals are popping up and like, okay, this is the nuances here. This is what we can work with. If I see that, oh, you can call on the energy of this food and this food will nourish the blood to be able to actually go in and get the mind kind of cleared because the mind is housed in the blood, right? So that we can do all of that. And then if there's this heart shock formula that's modified to the concept, if there's these flower essences that is going to support what we're identifying is your relationship to whatever that experience was, what'll happen is it just works. It
Mhm.
like, well, all of a sudden you notice in these very subtle ways, your behavior will change.
Mhm.
And yet it comes with such ease and can feel so peaceful. And
Mhm.
that's what I look for is when then I get on a call or I might get a text or something saying like, it's those texts that, oh my gosh, how I would usually do XYZ whenever blah blah blah. And it's like, yeah, you know, guess what happened? Like this happened. And then but I didn't flip out. or I
Mm,
was able to communicate this, or I didn't even realize that it happened. Somebody had to point it out to me that I
yeah.
had a different response to it. That is just how ingrained I'm looking for you to be, see and be your wholeness, is that it
Mm-hmm.
comes so naturally. Why? Because it's you, it's your core, it's your home. That's why it feels so familiar. That's
Mm-hmm.
why it did come with such ease,
Mm-hmm.
because it is you. And so it's like, what, in what way? So, same way with the acupuncture needle. When you put the needle in, how are we opening up the flow? And the reason why I was able to feel more comfortable and even transitioning out of traditional clinic was because one of my mentors said to me, and I told her, I was like, I'm just like, "Oh, I don't know what's going to happen if I just go, if I don't needle." And she's like, anything that moves the chi becomes the needle.
Mm. Mm-hmm.
So it's like, oh, that's true. And so like I was like, all right, sweet. And so like, so that is what happens, is like that person is just curious enough and ready enough to know that there's something more that they're looking for.
Yeah.
There's a type of existence that they would like more ease in.
Mm-hmm.
They're just not quite sure how to do it, or even for many of them, those core desires and the way that they want to be, it's they're the only one that knows it.
Right.
And so, and it could be because of a history of saying it out loud, and someone's like, "Psh, no, that ain't gonna happen," or whatever. And so then now, like, you're not expressing it anymore, or for fear of who around you might not even be there when you really do want them there.
Mm-hmm.
And so it becomes like, but it was enough, like I said, for them to raise their hand and say, I want to work with you,
Mm-hmm.
because they've reached that point where they're like, I have to do this for me. And
Yeah.
I want to do it for me, but I still want to do it sustainably and then still be able to enjoy these rich relationships with other people.
Mm-hmm.
And so, like, a lot of the stuff that I put out there and things like that, like, they'll see that I'm talking about usually introverts and empaths. That's common that come to me, um, and that they care for other people. So they might have gotten to that point, like, I'm done caring for other people. They get taken advantage of. I overdo it, put myself last, and did it. Like, that's what they, and then what happens is they want to go and try to shut it all down.
Yeah, let's
That's where
talk
the
about that.
boundaries thing,
Let's talk
the,
about that.
which part, the boundaries, like,
Well, okay, so somebody comes to you, whether they identify as an empath or not, somebody comes to you and they're like, I'm tired of caring for all these people. They take advantage and they think that the way to heal that or fix that is to completely do the polar opposite or shut it off to the extreme or whatever it is.
Mhm,
And that's not all, I mean, that's not always the case. So
right.
then what do you say? What do you do? Like I want to know your perspective on it, I guess.
It's so if when they say that, more than likely it's going to be followed up with, but I don't want to do that because I really do love people and I really do
Yeah.
care. It's usually followed up by
Yeah.
that. And those are signs too that they are a natural giver. Like, they are a natural um person that does care. They do see potential in other people, that they want to support them, right? In
Yeah.
whatever way that is. That tells me if that's your natural being. So then we just have to find a way for you to still do that in a way that actually is whole to you,
Yeah.
right? And so then and so that's where it is that we start looking at, okay, what other things are showing up? Like, oh, you're describing PCOS to me, and then, oh, you're describing like other, like bloating and mucus coming out, like, and there might be headaches involved that involve more of like a room spinning type of headache kind of thing. So I was like, oh, so it's really this type. Okay. So then now it becomes, this is how we can personalize your filters. And so I use the term boundaries because that's typically what people say. That's what they're looking for. I call them filters. Um,
Okay, I'm sorry. Can I pause you? Can I go
yeah.
back really quick? So, do you see certain patterns in certain types of empaths or certain type, like you were describing specific things, headaches, right? The bloating, the PCO. Okay. So, are you seeing clusters of health issues that go along with somebody who maybe is an empath or a giver in a way that isn't honoring to their body and to their
Yep.
Okay, we need to talk about
They're
that.
either they're gonna they're either gonna overdo it or they're gonna underdo it. And
Okay,
it'll show up in their body in different
right.
ways. And so we'll take like, the empath thing, like I was saying there. So empathic qualities, you hear a lot, the languaging that's used is, oh, you're absorbing other people's energy. You're taking things, too many things on,
Mm-hmm.
right? And then you hear them describe physical things that are happening.
Mm-hmm.
And they do describe whether it be like a fluid that is not exactly moving very well. They might feel a heaviness even when they're walking. This type of PCOS that'll come out where it's like it can be it can almost um feel weighted in the lower abdomen.
Mm-hmm.
There can be vaginal discharge. This is not cervical mucus. This is vaginal discharge. It
Mm-hmm.
can come out in like pooping where it's looser and all of that. So it's like interesting then because you're taking on quote unquote other people's stuff and you have difficulty digesting it.
This is very powerful for people to hear. Mm-hmm.
And so you can't digest it because it ain't yours to digest.
Yes, right.
And
Mm-hmm.
so that's where it is that we start to explore then, all right, you have these empathic qualities. We need that actually in the world. Because it's like a pulse on what's happening in the collective. And then you can kind of see what could be put in place or created for people,
Yeah.
for societies to function well and all of this jazz, right? Um, It's just seeing then, now we get to really play. Where did it come from that that caring meant that you had to do all of the things for these people?
Yes. Mm-hmm.
Where is it that now this fear comes up out of them because they don't think that person can do XYZ? Where is it that you're not allowing and surrendering? Where is it that you're placing expectations on others that is actually, as you're seeking to be seen as an individual in your sovereignty, that you're not doing that for someone else?
Mm-hmm.
Where is it that you're giving so much to that angle, that person, that group, and then you're saying, well, I'm not receiving anything from them. Well, who's to say? Like when we give and receive, who said that it needed to come from particularly that A to B? It could have been D that came
Yeah.
to A,
Mm-hmm.
right? And then so this is where it is that you really start to play around
Mm-hmm.
with where beliefs came from, how they're thinking, and then seeing, okay, for some, it can be it can be difficult to just all of a sudden be like, mm-mm, can't do that no more for them, right? So then what'll
Yeah.
happen is, all right, well, if that's the pattern that's popping up, how about we take a look at your food? Let's see what's going on there. And then we can see, you know what will help facilitate that like murkiness. We want to create some clarity, right? So we want to get the murkiness out. Let's go ahead and let's see if we can get you some Job's tears. Let's
Mm-hmm.
try that. Let me see. Let's see if what if we did some cucumbers here? What if we did a little bit of root vegetables because you're needing some love, right? Like, and then so that's a way that you can use the food energy for them to feel that. So that's just one angle, just one
Right.
angle. And
Right.
then and then you'll see, okay, are there some herbs that we could potentially use? And the
Yeah.
herbs even speak to the mental, emotional. It's not just the physical. Some of
Right.
them that, right? So it's like, are there essences? Are there oils? Are there other things that we can use that would position them? So once again, kind of thinking about them as a needle, I'm positioning that person
Yeah.
to be able to process what's happening in their life. So
Mm-hmm.
then as they make those shifts and those changes there, just because you make it in one area, you're actually affecting the whole body. And so
Yeah.
then it'll get to a point that, oh, now mentally we got a little bit more buy-in because
Yeah.
we just changed and shifted the physical. And it's like, okay, now we can work with this. And then they start bringing in like bit by bit. It might be like a circumstance with someone, with
Mm-hmm.
a spouse or whatever, and then we can jam about it, right?
Mm-hmm.
And then all of a sudden you see like what it is that they're like, I got to do this. It has to be this way versus what they want to do instead.
Yes.
And then seeing, so just having that sheer clarity as they move through is valuable. It's
Yeah.
huge. They feel like once then they can implement it. And then now all of a sudden seeing like they still love me or, oh, he did do that. Like, like, oh,
Yeah.
they're still around. Like and it's like, yeah. And even then the ones that choose to not be around, they're like, it's okay. I'm actually cool because they wouldn't have wanted to be by my side with this anyway. And they would have just slowed me down. Great.
Right. Right.
Precisely. You're creating the environment internally and externally that's going to support you to be who you are at your core. We
Right.
just have to see what's in that environment because we're going back to what I was saying. We're always in response to the environment.
Yes.
And
Mm-hmm.
so we're assessing and we're creating the qualities of the internal and the qualities of the external so
Yeah.
that we can try to be as congruent as possible. And then that's nourishing the person, nourishing the terrain is what we would call it. Um, Instead of trying to go and eradicate all the bacteria and the viruses and stuff that are a hell of a lot smarter than us. And they will adapt very
Yes.
quickly and very well. But
Yes.
if you can actually focus on the person and on the terrain, then whatever stressors come their way, I'm looking for you to be able to navigate those with more ease while still feeling like you're intact as a whole person.
Yes. I love that.
That was a
So,
lot.
no, it's really awesome. It's really powerful. And I really wish, I mean, now more people will know because we've done this podcast, but I really wish more people understood this.
Mhm.
Something that I believe so much with every fiber of my being. And sometimes it's hard to articulate because people will go, well, I need studies and I need this and I need that. And it's
Oh,
like, it's through it's through my own long journey. I'm 42 years old, my own journey with mental health and physical health and trauma and healing, and 13 years of practicing and all the other years of mentoring. And I'm like, I really believe that people can heal themselves
mhm.
for the most part. Okay. Like, obviously, that's not a carte blanche statement to every single
Yeah,
circumstance,
I
but
get what you're
I
saying.
really believe like probably 90%, maybe even more of things, people can heal themselves with the right tools, with the right guidance. And they don't have to go to some of these detrimental measures that sometimes they're led to by a mainstream Western medicine and things like that. And I'm not saying all Western medicine is bad either, but what I'm saying is people don't know this. They don't know that they could heal themselves, right? That they
Yeah.
could get guidance to walk that path. And for me, it's really disheartening and
Mm,
hard that people really don't know that. And it can be as far as it's not that they don't know, it's that they believe that they can't.
mm, yep. And then that's where it is that we're there to remind them that they can.
Yes.
And to, it's like, while still maintaining our own observational perspective
Yes.
and our own expectations and honoring that this is their journey. And so it's like,
Mm.
yeah, like how we were talking about that today in class because I teach also. So and that's what I was telling the students is like, yeah, you're always navigating that. You can more, we more than likely can see what it could be for
Mm-hmm.
them. And then we still have to honor their journey.
Yeah.
And for some, that's enough. Like, yeah, they're still going to come see you. They're still going to contact you. And it's like, even if you can point out any of the smallest or what seems like the smallest, because if we were to try to even neutralize that and not even say it was small, but just any type of behavior change, and then
Mm-hmm.
to reflect just from that simple change, what happened, that creates like that cascade. It creates some momentum for them to be able to see. And that's where it is that I look for reflections. And I'm like, you can reflect this stuff for yourself too, right? Like, so that you can see that. And I think like there's it is because I mean, this has been the whole conversation of just like how many things are involved and how many influences there are and everything,
Mm-hmm.
right? And so, I mean, we can even see where it is that we like for many people, you grew up like you might have been told you can't do that. Stop. No. Like it's like
Yes.
and granted, they're saying, you're about to walk off a sidewalk and quite might fall, kind of thing. But we didn't take it that way. We didn't have that like that
Right.
context. Yet that I can't still transferred and carried over. And then for some, like they grew up with like, I'm a parent, you're just gonna do what I tell you anyway. And so you didn't even grow up even learning
Mm-hmm.
about your own abilities because
Yeah.
someone else told you what they were,
Yeah.
or someone else just said, this is what you're going to do or not. Like, right. So it's like, we're really having to go and explore just how that did influence us into what we're seeing now and who we're seeing now and where they're at right now. But them simply showing up with us tells me that there's something that they know could be different for them.
Yes.
And that's enough to me. Like that's enough.
Mm-hmm.
And I think sometimes too, when it comes down to, especially like with the studies and whatnot, um, I think what helps is now you can actually hear about how the studies can be skewed and what you see. And like that's the other thing is when people are talking about, oh, these are peer reviewed journals. And I was like, yeah, sometimes if you actually go back and you can find, if you can find it, you'll see what might have been originally submitted was sent back. And they needed to change something in order for it to actually go into that journal. And so for that person, it may have meant more to be in the journal than it was to stand by what their findings were. And then you look at sample sizes, you look at the who was even in the sample. Does it even reflect you? Guaranteed no, because you're personal. You was only you made. And so if you weren't in that study, then like it may or may not work for you. So it's kind
Right.
of so like when sometimes when I put it into context, is now I say this as somebody that actually loves reading studies. I love reading what research is happening. I love seeing like the innovation and all of that. I find it like so amazing, so
Yeah.
beautiful, right? And then at the same time though, how can I still use that and take that information, but then still honor the personal person and what is it that we could offer? What can we introduce them to? Um, or
Mm-hmm.
something like that, right? And to get them to see that. Like that's what I meant when I said like some people declare their own prognosis based on a lab and they might do it based on a study. And so it's even with the studies, just as much as we see something that can, we can find a study that shows that it can't. And so so it's like so it's like how much weight do you want to put on that? And I think just some people are really just scared of their own power. I think that they're just scared because it comes with a lot more responsibility. A lot more like there's the room for excuses and for blaming isn't there anymore. That shielded, that protected you.
Mm-hmm.
And
Mm-hmm.
then now it's like to go and be able to say, huh, Yep, I did this just because. How many are really comfortable in saying
The thing is, when you
that?
say I did this just because, there's all these people around you who are like, what do you mean just because?
Because.
What's your reason? What's it has like people, that's where that empowered piece comes in because you have to be able to be okay with people questioning you. Not that it's
Hmm.
okay, but like people do it naturally, right? People you're in relationship with or whatever. And to have that knowing, like, I don't have to explain myself.
Hmm.
Right? I can just because, and it doesn't have to make sense to somebody else. It only has to make sense for me.
Yeah.
And I mean, the work you're doing is profound because not a lot of people have people in their corner helping them see that it just has to make sense for them,
Hmm.
you know?
And I want to say something as you said that this came up for me as well. And I don't know if it's just because I was seeing it a lot. But it's like it just needs to make sense for you.
Yeah.
And what'll what I'm seeing though is that some are even justifying it based on an identity and a diagnosis.
Mm-hmm. Mm-hmm.
And I just want them to be aware of when they're doing that because even then, it's still remember that you're going to be evolving as a person.
Yeah.
So, like this evolution of yours, how long are you going to keep that in context of an identity of a diagnosis?
Yeah.
So it's like to just be aware of, oh, this is what someone has diagnosed me with, whatever, that's fine. And I'm doing this just because. It's not because of ADHD. It's not
Right.
because of even then, not it and you're an empath. Like it's not because of chronic illness warrior and all this other stuff like that. No, you just it's just you. Period.
Right.
And so for people to get comfortable even with that, because those diagnoses and those identities actually are a form of shielding and protection and boundary.
This is
It
so good. Talk,
informs
talk about
people
that
how
a
to,
little bit.
and think about it like this is how people can trap themselves because when you lead with that, you are actually telling people how to treat you.
Yes.
You're training people how to see you.
Mm-hmm.
And then which can be actually paradoxical for the person because they want to be seen as themselves. They don't want to be seen by their diagnosis. But
Mm-hmm.
yet you introduce yourself as this person with this diagnosis.
Mm-hmm.
And then with that, you have no idea the other person on the other end, what their experience is like with that diagnosis, their interaction with that diagnosis. So this is why when there's this like overgeneralization with these, like you don't really know. So like I'd much rather just go out and be like, yeah, I'm Denise. Maybe in conversation you'll find out about some other stuff that's going on.
Right.
But when you because I see it a lot and because you see that happening even then when there's the healing that can occur is we end up having to explore what does that mean if this diagnosis fell off? What does it mean if that identity was not there?
Oh my
And
gosh. This came up for me recently. I was talking with my husband and I'm like, what is it? I've been thinking about what it's going to mean if I'm not X, Y, and Z anymore as I was like transmuting through some healing. And I'm like, I've identified that way for so long. What does that mean now for me that I'm not air quote that or that's not going to be a part of what I consider my identity? And it was very
Mhm.
interesting because it's very powerful how we label ourselves, how we think about ourselves, the diagnoses or the labels or whatever. And I it can literally quite shape the trajectory of our life.
Precisely. Because it's that inherent wanting it's we're such beautiful beings. It's this I want to be myself, yet I want to be connected with other people. Because it's
Yeah,
in and this is where it is that you're invited to see in what ways would you like to be connected with other people? What is it that y'all are in agreement on? It doesn't necessarily have to be a diagnosis.
right.
right? Now, are there points in time in your phases that actually would be so supportive? Yes.
Mm-hmm.
And then at the same time, just be aware of where you're at in your evolution and when it's time that you might be looking for different types of connection. And
Yeah.
then being open for that to change. So for some, they just want to still keep it up and still stick with it, right? And this has me thinking about like Dr. Martinez's work when it comes to studying centenarians, and like he's a cultural anthropologist. And what he had found, like the perspective of one's health, it actually showed up and changed their blood chemistry, because they would be in these groups of people that only really talked about their diseases or their conditions, their doctor's appointments, oh, my knees, oh, my back, like all of this, versus
Yes.
the ones who didn't do that because they weren't with friends that did that. And they took them out. They even did a study where they took them out of that and put them somewhere else, and their blood chemistry changed to where it had improved. But then when they came out of it and put it back, blood chemistry changed back to what it was, because now
Isn't that
once
wild?
it's environment, and you
Yeah.
are in environments different types all the time. And so it is, yes, being aware of that, like
Yeah.
which environments are you in, what are the common sayings amongst each other, and these aren't just sayings coming out of your mouth, more than likely is showing up in your body. Someone's
Yes.
talking about someone being a pain in the ass to you, oh, do you have sciatica? Like,
Right.
I'm so serious about that, right?
Yeah.
Like, or
Yeah.
oh, this person is pissing me off, and then you're talking about recurrent UTIs.
Mm-hmm.
Do you see
Mm-hmm.
what I'm saying? And it couldn't even just be that person, but it could be something happening like just around you, and your language is literally dictating what's happening in the body.
Yeah. Mm-hmm.
And so then if you find yourself repeating certain phrases, or you're hearing these phrases because of the communities and the groups that you're in, that is where it is that you can really shift it for yourself, because your awareness of it now has moved to consciousness. And
Yeah.
so now it's conscious choice.
Mm-hmm.
And here's the thing. I'm cool either way. I'm just your neutral facilitator.
Yeah.
And you know what I mean? Like that's just where I'm at. I just want you to be aware of what's happening. And
Mm-hmm.
then for you to realize your power of choice. And
Yeah.
then you kind of like, you're going to make the choice, and then what? Okay, cool. So what's your interaction steps for that?
Mm-hmm.
Or to go like and how is that integrating? How is that resonating with your authentic being? Does it go along with that, or doesn't it? Kind of think. And if it does, then we won't really see these other signals popping up. If it doesn't,
Yeah.
we'll see something. And so, someone's gonna come up, because we can try to reason and logicize, like you said. And I'm same way, same way. Oh, I can be very mental about a lot of stuff, and I can overthink a
Yeah.
lot of things.
Yeah.
Um, and then that's when it is that, like, especially when I'm like really confused on how to deal with something, I'll be like, you know what? I've been feeling this around my hips. So that must mean that I am really struggling with the choice. But then what about the choice? Is it that I don't believe that it can happen? Is it that somebody might not buy into it? Is it
Yeah.
that I don't have enough information? Like, so then I start really going in and exploring that. And then just simply kind of becoming aware of that and exploring it.
Mm-hmm.
Then I could feel it go away. I could feel it like start to assuage. And because all I needed was for me to just pay attention to that, what was going on.
Mm-hmm.
Right now, whether or not I implement, that's a whole nother thing, right? Like if so,
Yes.
so it's like, ah, did I implement it? Did I not? In what ways? And so, did I need support? Did I need more support? And if
Yeah.
I did, then in what ways does that look like? And so that's how it is that people even then gain clarity. It's not just about what it is that they're desiring, but they're gaining clarity about the what's in these environments that they need.
Yeah.
And in their care team and all of that stuff too is just like you become very, very clear, and then being able to communicate it as well.
Mm-hmm. I love this. Okay. So in wrapping up, is there anything you want the audience to know? I feel like we've given them a
Mhm.
lot to chew on.
Yes, yes.
And
It digests very slowly, and you have the enzymes coming from the divine.
what do you want to say? Because I think sometimes when people hear podcasts like this, it's like, oh my gosh, that's a lot. I don't even know where to begin. It's like you just have to begin. You don't need to go, we said a lot of things. You shared a
Mhm,
lot of things. You don't start out doing all those things, right? It's like little step by little step. And
mhm,
so that's what I always encourage people is you just have to take the first step.
mhm.
And then you'll take the next step when you're ready and the next step and you'll get
Yeah,
clarity along the way. You don't have to eat the whole elephant at once. That's not even possible.
right.
And so I'd love to just hear if you have any parting words of wisdom. All of your links are going to go into the show notes so people will be able to find you um,
Yay.
and grab your information and connect with you. But do you have anything else you want to add in like closing to this conversation?
Yeah. One, I would say if they reach to the end, you actually completed a step.
I
Yay!
love it. That's very
So
accurate. Yes.
you already did it. Like, so I'm like, woohoo. Now it's like, all right, so what's next? And I would say that let me just let you know that when you're looking at healing and you're looking at health, and it's been very convoluted, but I'm going to tell you that the root meaning of health is whole, is actually coming to wholeness. And did you know that the root meaning of perfect is wholeness? So, if there's anything that I could encourage anyone to see is that you are whole,
Mhm.
you're complete, you are perfect, and you can be who you would like to be and express that. And it's just going to take you realizing that you're whole, but you're already here at this point. So you're like, actually, yeah. And it's just a journey of coming and being in your wholeness. That's all that it is. And
Mhm.
everything else is just icing and frosting on the cake.
I love that. That's amazing. Thank you for the time that you've spent with us today. You guys go check Denicia out. All of her links are going to be in the show notes so that you can check out her website and her social media. And I encourage you, if this resonated, to have a consultation with her at the very least.
Yay. Thank you so much, Andrea. This was
Thank you.
great.
You guys, we'll see you next time.